Great. So today's webinar, titled Transform Care Navigation for Maternal Health Journeys and Chronic Condition Management, is brought to you by Ushur. Ushur is a longtime partner and supporter of MHPA and our health plan members. In fact, Ushur was awarded the Isidore King Spirit of Service Award at MHPA's annual conference a couple weeks ago in Indianapolis. The award is named after past MHPA board member and former CEO of the Wellness Plan, Isidore King, and recognizes an MHPA partner company that has been exceptional in helping further the mission of MHPA and our health plan members. So I want to thank the entire Ushur team for their partnership, pulling together today's session, and their longtime support of the organization. With that, I would like to introduce our presenters for today's session, Yvonne Daugherty and Stephen Jacobs, both from Ushur. Yvonne is the healthcare industry leader at Ushur and brings more than 30 years experience in healthcare via marketing and communication leadership roles that benefits brokerages, TPAs, and health plans. She also worked for United Healthcare in marketing, brokering, and employee and member communications for 6 years. Throughout her career, she has specialized in more effective and influential communications that drive engagement, better experiences, and better outcomes. Yvonne leads the healthcare strategy and go-to-market at Ushur, serving as the bridge between the business and the market to ensure alignment with evolving trends, regulations, and requirements. She is also Ushur's subject matter expert for member engagement and activation best practices, working with clients across the US and around the world to implement more effective omni-channel business-to-business and business-to-customer communications. With 19 years of experience in healthcare automation, Stephen Jacobs is a senior solution consultant specializing in intelligent automation and workflow analysis at Ushur. His extensive background equips him with a deep understanding of the complexities and challenges within the healthcare industry, allowing him to deliver innovative solutions that harness the power of AI and automation to enhance operational efficiency and improve member and patient outcomes. With all that being said, I'd like to turn things over to Yvonne and Stephen for today's session.
Awesome. Thank you so much, Eric. And I want to return the thank you to MHPA for your amazing support. And we're obviously very humbled and honored by the award as well. So thank you again. And thank you everyone for attending today. What Stephen and I are going to go through is the current state of US chronic conditions and maternal and postpartum health, little market landscape, what we see as hindering effective Medicaid communications today, a little bit of a look into what some MCOs are doing now for more effective communications. Stephen is going to show a live demo of care navigation for pregnancy, so I'm excited to get to that. And then we're going to wrap up with some care navigation communication best practices, and then we'll move into the Q&A. So I will quickly jump us into market scan. I completed this very currently to look at what is going on with US chronic conditions and maternal health as far as costs, as far as health equity, really wanted to get us grounded in what's going on. And I'm going to start with an emphatic statement. Navigating the healthcare system is incredibly hard, but navigating the healthcare system when you're facing a chronic condition or a pregnancy is confusing. It's scary, it's frustrating, it's daunting for everyone. I don't know of a person I've talked to who's tried to go through this for themselves or a family member. It's not easier than it was a while back. So too much care that's very much needed is being missed due to too many hurdles. And you're going to see the impact of that missed care and the lack of correct navigation in some of the stats I'm about to share. So the criticality of effective member engagement in this area is paramount. And I consider myself to be pro level at navigating the healthcare system. And I have been navigating the healthcare system for a chronic condition for the past several months. And I will tell you, it has been incredibly difficult figuring out what providers to see, trying to minimize out of pocket, trying to get medications, trying to get past prior authorizations. I could not do it alone. And I have all the resources in the world available. And it really took tenacious follow-up with my health plan to get needed care management and care navigation support. But once I had that, once I had the support, it became incredibly much more easy. It became much more of a relief. And so I'm really more passionate than ever about sharing the information on this topic. So let's look at the crushing impact of chronic conditions really quickly. 90% of the nation's $4.5 trillion in annual health expenditures is for people with chronic and mental health conditions. Pulling that over into Medicaid, 30% of the US population is enrolled in Medicaid or CHIP programs, huge numbers. The increase in Medicaid spending is continuing, 805.7 billion, or 18% of the national health expenditure. The Medicaid managed care spending, 508 billion, up from 468 billion. So these are growing and growing and growing despite a lot of great efforts. So the whole chronic conditions, the whole struggle with navigation cascades into maternal and newborn health. Navigating the healthcare system for a pregnant woman, a pregnant person, is incredibly complicated, just like with chronic conditions, making sure that they get the care they need for themselves, for their unborn baby, and then once the baby is born. Add in the challenges that Medicaid beneficiaries face, resource constraints, a lot of struggles that are beyond what really others are facing. It just makes it that much harder. So I just have some stats here on the number of people in Medicaid and CHIP plans now. 26% of the 92.1 million are females in their reproductive years. 41% of US births were paid for by Medicaid in 2021. 12% of Medicaid births were preterm in 2021. 25% of low-risk Medicaid births were cesarean deliveries. And then if you flip over to the right side, chronic conditions hit this population as well. High blood pressure, diabetes. These can really feed into higher risk, more maternal and infant morbidity, worse outcomes. And this is for the moms as well as the babies. So the true cost of US maternal morbidity is what happens to the mom, what happens to the child, their medical costs, their non-medical costs. And that's really the total societal cost of maternal morbidity. And then really, US has the worst outcomes for pregnant and postpartum women than any other high-income country. And then, getting into, the element of health equity. There are, women who are Black, American Indian, Alaskan Native, who live in rural areas, as well as others who face much higher rates of maternal mortality and morbidity. So there's that element stacked on top. And the children of women with maternal morbidity, we know they have higher risk of having chronic health issues, asthma, cardiovascular disease, developmental disorders, depression, anxiety. So it cascades. And that's why getting the support and the communications to these populations is even more critical than ever. When I was preparing my research and getting all of these updates in, this news hit last week, came out through Fierce Healthcare. HHS put out a report, and the headline was really Medicaid insurers can do more to improve maternal health access. I've got a link here to the full report in case you didn't see it. Here's a bit of a summary. The report is states could better leverage coverage and access requirements to promote maternal health care access in Medicaid managed care. And the statement is that states could better leverage coverage and access requirements in support of maternal health. And they pointed out that all states require MCOs to cover OBGYN, physicians, and hospital births. And really what they're recommending is the coverage on this be extended to other types of maternal health providers and professionals. Midwives are called out, maternal fetal medicine specialists, lactation consultants, doulas, community health workers. So Stephen, you can go to the next slide. Mm-hmm. And they really called on the Centers for Medicare and Medicaid Services to step in and make sure that states start to cover these important additional provider types and give it additional guidance on OBGYN network adequacy standard. So CMS has responded and agrees. They are going to respond with a plan of action within 6 months. So really what this means is whatever changes are coming are going to be as important as ever for the plans, the MCOs, to communicate out to members. This is different benefits. This is different providers. This is different support. So next slide. I'm going to shift gears into what I am seeing working with our Medicaid MCO plans nationwide and being part of a lot of conversations with MHPA members. Really what I'm seeing is common confusion and friction factors. So the Medicaid members are facing an extremely complex healthcare system, foundational lack of resources, SDOH, health literacy, too much information, too many places. And I've illustrated on the right where a lot of the information is being shared. There's mailers, there's printed materials, sometimes apps, sometimes portals. Call centers are carrying a lot of the load. A lot of one-way SMS or MMS messages going out. There's care managers and navigators, community centers, resources, providers, websites. There's a lot of information being put out there, a lot of different places. But what we're seeing is a lack of an effective interactive communication channel that can really get members to exactly what information they need when they need it. And a big barrier to this has been PHI. When you're talking about chronic conditions, you're talking about pregnancy, PHI is going to become part of the communications. And so there's just this hesitance. How do we communicate but keep PHI protected? Next slide. So I won't belabor this. MCOs are just seeing so much that your members need from you and so much that they're looking for. I threw in just some verbatims that we have gotten in our engagements on behalf of the plans. Look, everything from, how do I find a primary care doctor to why isn't the medicine my doctor prescribed covered? I don't have a ride to my appointment. Just so many things that members are needing help for. Next slide. And I have really been steeped in this working with our MCO clients. MCOs are combating so many hurdles in this communication factors. Members have lack of technology and internet access. They're facing lack of meeting basic needs. They need food, they need shelter. Some of them are incarcerated. There's lack of adequate provider networks. There's language requirements. One of the largest ones I have seen over and over and over is MCOs are trying to figure out how do we do effective communications digitally, but still fit in with what federal, state, and county rules and regulations are around communications. How do I do it differently and working within those restrictions? So I'll cover some of this in the best practices, but this is stopping some plans from moving forward and really doing what's needed to drive change to be able to communicate more effective. So next slide. This is just some of what I'm seeing MCOs doing now, the ones that I'm working with, and some of what I heard at the MHPA conference and other webinars is, you can go to the next slide. Really driving innovation in digital navigation, doing it differently than has been done before. So very timely, data-driven, two-way, so interactive communications with just-in-time information. At Ushur, we call them micro engagements. Jump in with just what's needed, jump back out. And having a HIPAA-secure channel, having the ability to share PHI, PII in these conversations changes the game. Fitting in with existing channels. So I have an example here of digital in the middle, printed materials leading to digital, mailers leading to digital, call centers back and forth between digital, care managers and navigators being able to take advantage of digital and chat rather than live phone calls. So really just a lot of being able to fit digital into the world and really being able to support members year round. So you can go to the next slide. We have been seeing a lot of clients digging into data, digging into their ratings. This is an actual health plan, a Medicaid plan, NCQA rating. Finding out where are we having the biggest pain points. This is a particular health plan, 3 stars, and this is their 2.5-star diabetes rating. And they're looking at this and they're figuring out how do we best communicate to members to get them to take different actions to raise these ratings. And we are seeing effective communications support a raise in these measures. So here, I'm just going to quickly cover diabetic eye exams, diabetic glucose control, diabetes, statin medication adherence, kidney health evaluation, the standard things that diabetic members really need to do. And you can go to the next slide. And I'm just going to quickly walk you through this, and then I'll go a little bit deeper dive into one of these that's for pregnant members. This is a real example of how MCOs are using this digital channel and bridging back and forth to other channels to make a diabetic member journey and outcomes more effective throughout the year. So this just shows linearly along the year, starting out with benefit and services literacy outreach, then jumping in with a health risk or health needs assessment with some SDOH to help you know a bit more about them, to guide what happens next in your communications, getting a diabetic member enrolled in care management, getting them the hand-holding they need to get to an annual renal exam. And the bullets here, we'll get you the slides. You can read through some of the steps that are in these. The next one, diabetes care guidance for blood glucose. Jumping in post a care experience to really find out how did it go, what went well, what didn't, to give you a chance to address it before they get a CAPS survey, for an example. And the last one is, jumping back in with medication adherence for statin. You can go to the next slide. I'm going to shift over now to the pregnancy analysis. So we have a lot of clients, they know where they have pregnancy pain points. This is a NCQA rating for a plan for women's reproductive health, 1.5 stars. They knew they needed to focus on prenatal checkups. They knew they needed to focus on postpartum care and prenatal immunization. So Stephen, you can jump to the next slide. And I am going to talk through this highest level and then as quickly as possible, hand this over to Stephen to show you what this really looks like for our clients who are doing pregnancy and postpartum care navigation journeys across the year. Again, we always recommend starting the year with benefit literacy and services outreach. I recommend when you find out a member is pregnant, let them know what their specific pregnancy benefit services and support are. Then get into a pregnancy-related health needs survey. Find out what risks they know about, what risks they don't. Ask them about their SDOH needs so that you know how to support them and guide them with that throughout the year. You can use digital to get them enrolled in pregnancy support programs, care management, send them to, your educational resources, and then jump in and out throughout the pregnancy. I just picked some key milestones here that are quite popular with our clients. The very first one, make sure they have an OBGYN and they have an appointment and they have transportation to get there. Then jump in later, 11 to 14 weeks, letting them know they need to go for their first trimester screening. What do they expect? How do they prep? Helping them get that set appointment and then reminding them. So jumping back in the second trimester for an ultrasound appointment, and then jumping in third trimester, getting their gestational diabetes labs. These are just examples throughout the year of a pregnancy. We have plans who are using our solution to jump in and capture life event. The baby is born. You need certain information. You need to capture a birth certificate. You need permission to enroll them in your plan. You need to help them find a pediatrician. And then really, jumping in again with postnatal. It's a pretty big deal once they've had the baby. There's more support needed than ever. So how do you help let them know you're here for any postpartum needs, concerns, questions for the mom and the baby? So I am really excited to turn this over to Stephen and let him talk you through what he's actually going to demonstrate here.
Great, thanks, Yvonne. Yeah, so let's just take this a step further. As we were just talking about, obviously there's a lot to go through in a journey like this. It's a lot of information to send. It's a lot of information to receive. It can be difficult connecting with members at times. So what we want to do is we want to show you how we can make these engagements easier for you to work with. And what we're going to focus on today specifically are the 4 that you see highlighted here. We're going to talk about an outreach program where we're working to get benefits and services information out to a member. Then also setting up a system that's AI powered. It's using Gen AI to make getting information or an FAQ system readily available to them. And then going into those surveys where we have to collect the information to better serve the customer at the present and in the future. I'm sorry, the member at the present and in the future. We want to then go on to showcasing how we can set up and find an OBGYN for the expecting mother, set up an appointment, and then transitioning over to that life event where we're going to go through and we're actually going to capture information. We're going to make sure that we can enroll the newborn. We're going to receive the birth certificate from the mother, and we're going to get the child enrolled into a program. And then we're going to have a few other things throughout this. We're going to do a live call. We're going to do a live chat with an agent, just showing the flexibility and the power that you can have when you use Ushurs to perform these engagements. And when I say that, when I say an Ushur, we're talking about that workflow to help to take and to manage that task. And so let me stop sharing now. And let me just set up my demonstration real fast. I just need to get one system up and running. And then we'll take and we'll walk through each of the scenarios that we just displayed. Yeah. All right. So from here, let's talk about getting that benefits and services information over to our members. And so I will share out my screen again. And Yvonne, if you can just give me a thumbs up to make sure that that is coming online. You can see my phone there.
See it.
Perfect. All right. Well, when we start talking about these engagements that we're going to be working with, they're omni-channel. You can send an email with a link to kick these off. These can be voice interactions. These can be SMS messages that are sent with a secure link to take and to start these. So really any way that you need to get information to your members and use their channel of choice, their preference, we can take and do that because we want to drive up the adoption of this system and the acceptance and the click-through rate to make sure that we get it as high as possible. So what I'm going to do is I'm going to start this by sending out an SMS message. So you can see that we've got a text coming in from Circle Health letting us know that we've got information about a plan. And so what I'm going to do is I'm going to take and I'm going to launch the link here. And what we've done now is we went into what we refer to as our invisible app. So this is an app-like experience. So you notice there was no download that I had to go through. I didn't have to log into any system to get to this information, but it's now a channel, a very secure channel that's HIPAA compliant, where it's secure, it's encrypted. We can exchange PHI or PII or documents that will allow me to really speed up the interaction of these engagements. Now, we can't do certain things like enabling multi-factor authentication or having challenge questions like you see here. If we want to take and prompt for a date of birth, then we can do that to just ensure that we're working with the right member. But it's a very easy to use system to really get at getting the information to our members or receiving the information that we need to continue on inside of a process. And so from here, with this particular Ushur that we're talking about, we're just delivering information. Obviously, we're starting with a message with the appropriate amount of empathy here and making sure that the member knows that we're here to help them through, whatever the situation is currently in their life. And so as we go through this is just set up to get details out to them, whether it's about care management, care coordination, and the different services that we can take and assist with, around education. And you can also send links and articles along this and keep everything inside of this engagement so you can control it. But also if there are newer types of services like doulas that are starting to become more popular, we can take and make sure that the member has this kind of information readily available to them through this kind of outreach. And so it's just a very simple way of showing how we can get details to that member. But again, talking about being omni-channel and being as flexible as possible, we don't want to just do outreach. We want to be able to make sure that the members can get to us at any time they need. So if, the expectant mother was in a doctor's office or a clinic, maybe she had a flyer with a QR code that you delivered, or there was a hashtag that you published where they could send a text message in to start an interaction. That's what we're going to talk about here, where we can say, all right, well, if we've got a system that's available and we want the member to be able to get directly to that, then you can see that as easy as sending a message to a hashtag, it's going to start the next engagement. You can see here that, we're still following HIPAA compliance here. We can use the first name if we want to tailor the message a little bit, but, thank you for contacting us, Sarah. And of course, there we go. Let's make sure that we've got our secure link available here. And once we start this is where we're talking about that AI-powered FAQ system. So here, what we're doing is making an AI agent available to be an interactive conversational channel for the member. So if we have documents that we want to take and to load into the system, we can take and we can focus those large language models, those advanced Gen AI techniques against these documents to provide specific answers. Large language models are great about answering generic questions, but what you want to do is you want to be able to leverage that same kind of technology to get your information to your members. And so if we look now, we can see, let's have Sarah go through and ask, what can RSM, and RSM provide for pregnant women. And so what it's going to do is it's going to go out, check against the system where we've uploaded that documentation, and you can see that it's responding back with the appropriate message here. So if we take a look, we can see that for this particular Medicaid program, RSM, it comes back and tells us specifically what the benefits are for a pregnant woman. Likewise, if we want to keep going with this, and we can ask the system who qualifies, we can send that question over. The system will come back and it will give us the specific details around the individuals that can apply for this program. Now, this has obviously been very conversational, very dynamic. You can see that we're using standard language that you would use inside of a conversation with a person, essentially, to make this very easy to use. You don't have to be tech savvy to go through and to interact with a system like this. As a matter of fact, with our last question, I'm going to say, how do I apply? And I'm going to make sure that I have a typo here. I'm not going to put a question mark, but you can see that the system will still go back through, bring back our response, and give us the details around applying for this particular program. So using these AI-powered FAQs, you can use your documents and your informations and put an AI agent on top of that to make it very easy to interact with the members so they can get information or to launch other programs as well. So with this, let's start on some of the pre-care work for pregnancy like we had talked about. So now let's go through and handle some of the surveys that we were looking at. So the health needs assessment, the SDOH, let's go ahead and I'm going to launch that particular program. So we're going to get another text coming into the system. And so you can see that all of this is being done through SMS. Again, we could do this through email, we could do this through voice, but this is just a channel that's very easy for us to use. We all have our mobile devices on us. We're all used to going through and using these styles of app-like applications now. But what I'm going to do is I'm going to take and I'm going to launch the invisible app again, now for the surveys portion and engagement that we're working on. And what we're going to do is we're going to go through and collect the information from our expectant mother, and we're going to ask things, you know, are you currently pregnant? How far along are you? And you can also see as I'm going through this at the top here, we've got a progress bar. So anytime you send out a survey, you want to make sure that the individual knows at what point they're at in the engagement, because, you know, filling out information just page after page after page can be daunting when you don't know how much you have left. So we want to let them know exactly where they are to, again, to pick up the engagement rate here as we work. And so then we'll put in the expected due date. And we'll continue on. Now here we're getting to the point of where this is where it can branch off to different flows or sets of conditions that we can work against. We're going to say that this is going to be a single birth, and then it's going to prompt for any known conditions or issues that we know about with the pregnancy here. So you can see it's a long list. These things are things that we would want to capture to know about as we continue working with the member in the future. For this example, we're going to say this is a healthy pregnancy with no current issues or conditions, but you can see here that, you know, based on any of these, then we could take certain acts and go down certain paths to drive the services and the care that we're providing. Now here, once we get past the conditions, once we get to the SDOH portion of this, we can see that we can prompt if there are any kind of issues preventing the mother from getting to any kind of medical appointments that she has, or with any other issues that might be preventing the care that she needs. So for example, I'm going to just, you know, say that there may be an issue with transportation. I'm going to go ahead and I'm going to check this off to make sure that we note this. And so we can make sure that the answers and the ushers that we provide in the future are aware of this, and we'll take that into consideration. So very quick, easy way to go through and to collect information. And next, what we're going to do is we're going to go into those first trimester ushers that we were talking about, where we're going to take and help them find a provider, set up their first appointment, and get ready for that first trimester screening. So again, here, I'm going to launch this particular Ushur. We're going to get another text message, and we're going to get another secure link. We'll go back into our invisible app. And here you can see that when we start getting ready to help them find an OBGYN, you can see that we've got their information available to us. So we're just going to provide the address and have them confirm it or update it here as need be. But we're going to go ahead and Sarah's going to confirm her address. And when I click next, what it's going to do is it's going to go out and it's actually going to find the different providers in her area so she can go through and make a selection of which one she wants to take into work with. And so we can see that we've got her house on the map there with the blue dot. She's lucky enough to have several OBGYNs in the area. We'll go ahead and we'll make a selection. We'll say that we'll select Dr. Carroll here, and then we'll go on. So at this point, we found an OBGYN. We want to set up that first appointment. And what I'm going to do is I'm going to have the system make the call for Sarah so we can prompt her if she wants us to connect her to the doctor's office and provide additional information. And so what you'll see is in just a moment when I click next, it's actually going to call out to the doctor's office. It's going to have a text to voice message letting them know who's calling and what they're calling about to provide context for the member to make it as easy as possible. And so you can see that we're going to get a call now.
Customer is waiting to speak with you about scheduling a first trimester screening with Dr. Carroll. We are connecting you now.
So again, just another piece, another service to make these engagements as easy as possible. Not only that, not only were we able to help them find a provider to help them get to the point of setting up the appointment, but we can also send reminders as well when the appointment's about to happen and to see if there's anything that we can help with. So if we go into this reminder Ushur, we can see that it's prompting, letting them know the doctor that they're seeing, the date and time, the location, and asking if they need help with transportation. So this is going back to the information that we captured from the surveys saying, you know, we noticed that there was an issue with transportation before. Is this something that we can help with? We'll say yes. And then if there are services or anything that we can take and provide here, we can list this out for them. So if, for example, if there were no cost rides available, then we could take and we could set this up through Lyft and have a link directly available inside of our invisible app, still inside of the same engagement. And then that way we can help make sure that there's no transportation issues and we can complete this. Now, for the last Ushur, we want to help with the life event. So we've got a notification from the hospital that the birth has happened, and we want to take and to enroll the child inside of the Medicaid program at Circle Health as well. And so what we're going to do is we're going to send out, one last time, we're going to send out a link to our new mother and prompt her, letting them know that we've got the ability to help through this process as well. And so coming inside of here, we obviously want to, again, be as empathetic as we can, making sure that we're making the member feel safe and helped throughout this entire process. And so what we're going to do is we're going to prompt them and let them know that we can be the representative to send the information to the local county offices to get the child enrolled, to make sure that they have care after the 2-month period. If they say no, for instance, if they say, well, I don't want to do that right now, or I don't want to handle that right now, we just want to sometimes, you know, confirm this with the member, or maybe to reiterate a point of how important it is to go through a particular process to say, well, you know, if you don't do this and you forget, then the child won't be covered. So we'll have Sarah go back and say, you know what, yeah, let's go ahead and enroll them. And so then here at this point, we're going to prompt Sarah to upload the birth certificate. And so we've got a copy of that here. And so what we're going to do is we're going to upload this. And then what it will do is through intelligent document automation, it'll take all the different pieces of information from that document, grabbing the child's name, the date, the time, the location, all the important pieces of information to where we can go ahead and start that enrollment process, and we'll load that into a record. And you can do this with birth certificates, driver's license, any standard document that you want and any unique document that you want to train up, we can do that inside of the system. And along with receiving this kind of information, you can send ID cards or the like as well through this secure channel. Now with this, we give one last message letting them know that they'll receive a confirmation letter within 30 days about the new enrollment. And then last, we want to go through and say, we understand this is a difficult time, and we just want to make sure that we can provide as much help as possible. Would you like to speak to a live agent? Sarah remembers something that she did want to talk about, and she'll say yes. And so we'll kick this off, and what you'll see is this will connect up to a live agent, and then we can start having that interaction with Sarah directly here through this particular Ushur. And so we'll take, and the agent will ask how they're doing and what they can help with. And Sarah will say, I need, diapers and formula for my newborn. Okay. The rep will come back, respond to that. Obviously, we want to congratulate the new mother, but also make sure that we let them know that we can send out a kit with the diapers and the formula they need and a few other items, but we want to make sure that we've got the appropriate address. So we'll take and we'll send this out. We'll get the address. We'll have Sarah confirm that that is indeed still her address. The agent will take and respond, but as you can see here, this is just a way to show yet another channel, whether we're doing a live chat with an agent, we can make this available, whether it's a live call that we're placing, whether it's an AI-powered FAQ system. All of this is still available within the same Ushur. And we'll take and we'll say that there isn't anything else, and we'll have the agent then end the call. Perfect. And so with this, what you're seeing is, I'm going to hop back over to PowerPoint real quick. This is just a way to go through and to create Ushurs to handle these micro engagements that are any step or part of a longer journey, to take and to handle getting information to a member, to get information from a member, and that's whether it's pure data or documents, to make sure that we can take and inject links to documents, links to videos, make sure that we can assist them with the social needs along with the health needs, but just wrapping everything into a single system where you can build out these workflows to handle these. And I do want to say as well, we're not going to be showing this today, but the Ushur Studio is a no-code environment. So you don't have to be a developer or a data scientist to go through and to construct these Ushurs. They're very simple flows that are built in a drag and drop fashion. And regardless of the channel, whether you're doing SMS, text, email, it's all the same studio to take and to configure these. So very easy to use and very easy to take and to present these back. And so Yvonne, with that, I will.
Yeah, thank you. Thank you so much for that, Stephen. I appreciate you walking through that and explaining as you were going along. It really, I think, brings to life the journey path and how this type of communication is different. So I'll wrap us up quickly. We've started to get some questions in the Q&A, and I'm going to jump into some care navigation communication best practices. These are what we've gathered, some of our own, some of what we've learned in working with our MCL clients. And I'm going to be able to answer a couple of the questions as I go through these. So Stephen, you're not going to enjoy it, but there's a lot of build in these slides. So
No
if you click, just go ahead and click through until you see limit what you're asking.
There you go.
And one more. All right, so I will start by saying our clients have had to tenaciously request from states and counties the ability to use digital channels that are different and adjust messaging from what's the standard and what's approved in order to be more effective. What Stephen showed is a lot of what our clients are currently using, and it did not fit the mold of the approved language and the things that they were being asked to do. So what I've talked to our clients about, and I love how they are continuing to do this, is just tenaciously request the ability to do things differently. Use all channels to get members to digital and then get them back into live when appropriate too. So Stephen showed digital engagement being sent through an SMS. He showed a member putting in a hashtag. We have clients putting QR codes that are personalized on mailers, generalized on printed collateral. Live agents can get people into digital. So one of the questions that came in is, how are you getting people to digital if you don't have their cell phone? That's how you use other channels. You ask them if they will opt into digital, you get their cell phone number, and it's helping to fill in data gaps. You'll see what Stephen showed. There was always a what's in it for the member in all the communications. Let them know what's in it for them to do what you're asking, and they'll be more apt to do it psychologically. Use understandable and clear language that members will understand and act upon. Know what you want them to do. Ask them to do it. All humans will be more apt to do what you clearly ask them to do. Marketing and communications, high level. Be targeted and timely in your communication. So leveraging data, Stephen showed where we knew from an SDOH survey at the beginning of the year that the member had transportation issues. When we knew they needed transportation and they were scheduling a doctor appointment, we connected those dots. That's the power of data and insight. Really guiding members more comprehensively. Just sending an alert, asking a member to take an action is not as effective as if you do whatever you can to guide and to handhold as long as possible to help members take the right action. These type of engagements simplify the navigation of the healthcare system. And I would say limit members, what you're asking members to do in each communication. Don't throw too many requests or requirements in just while you have their attention. Choose one or two most important things and focus on getting that done. The next slide. And I will
I'm just going to build this out.
Yep. Thank you. Just looking. Okay. All right. I'm glanced at the Q&A. I'll get to those as quickly as possible. It is possible to improve benefit literacy, to drive higher utilization in things that need to be utilized in these types of communications. So educating members, as Stephen showed, with the pregnancy benefits, let them know what's available, not just at the beginning of the plan year, but when they actually need it. So he showed the mom saying she needed diapers and formula at the time of birth. Keep letting members know what you have to offer at the right time. Again, educate and simplify, to help members understand exactly what they need to do, why and how. Another big thing that I am really continually pushing is know why members are non-adherent. Why are they not going to the doctor? Why are they not going in for labs? Why are they not taking their meds? You can ask them in a survey like Stephen showed, and then you know the root cause, and then you can address it to overcome the hurdles. Very important for all adherents. I already mentioned this, that overcoming SDOH and other hurdles proactively. Helping members locate nearby care. Stephen showed allowing them to find closest providers. Also let them know when there's virtual options. Really bridge with these engagements. And then I've heard this over and over again. This was reiterated at the MHPA National Conference 2 years in a row that I've been a part of it. Utilize provider, community, SDOH partners to help get your joint messages out. It is proving effective if you all can work together. So that's really all that I wanted to cover. Let me quickly jump over and scan the Q&A. So one of them I had answered is, how are you doing this messaging when your clients don't have cell phone numbers? You can collect that digitally. Let me just see.
While you look through that, I'll give you a moment. I also want to say,
Yep.
when you're focusing on the why, with channels like this too, when you're trying to collect information, when you're asking about, why didn't you make it to an appointment? Why weren't you taking medications? Channels like this can really be, members tend to be more open, right? If they're speaking to someone face to face, or if they're speaking to someone on the call, they might be a little embarrassed by something. So if you're sending a text message to collect the same information, but it may be a channel they're a little more honest in, to where you can, make sure to get that information as well.
Yeah, amazing points. Yeah, thank you. I appreciate you adding that, because it is true. And okay, how are you handling all client language requirements? So we work in partnership with our clients, and often they have language translation teams, culture teams, health equity teams that are a part of the the messaging. So our platform can actually handle displaying the languages properly. So we can take the translated language and feed those in. And when a member asks, just, for Spanish or another language, we can switch and serve it up. And even languages that read right to left are served up correctly. So the platform itself, our platform, has more than 60 languages that we can automatically translate. And then also we can accommodate what our clients are doing. So one of the questions that just came in, what if they don't have cell phones? This is really something that we are seeing as a big gap. And we're seeing particularly MCOs, states, counties, working to get cell phones into the hands of Medicaid members, and that, through a lot of different means. But really, this type of a digital communication does rely on a cell phone or some way to access a tablet or a browser. And we are really just, encouraging our plans to do, whatever is, they're able to do, but know that there are government entities as well as plans that are providing cell phones. Let's see. You mentioned this question, you mentioned PII and PHI data. How are your clients getting approval from their state and county DHHS to do this type of digital communication? So I hit on this a little bit, but since this just came in, I'll clarify. They are really going back to these agencies and communicating their inability to effectively communicate, and sharing examples of how they would like to do it differently. And some of our clients are non-competing and are working together to share case studies, results. They're using some of Ushur's Medicaid specific results to continuously further that conversation. We have just 2 minutes left. I have covered all of the questions in the Q&A. I hope I covered them sufficiently. Happy to follow up afterwards if I didn't. Otherwise, Eric, I can go ahead and let you wrap us up.
Sure, absolutely. Just like Yvonne said, if you guys have more questions at a later time, feel free to reach out to the Ushur team. You can also reach out to MHPA. We'd be happy to connect you as well. I do know that Ushur is planning a follow-up communication with more information and potentially the slides as well. Another quick housekeeping reminder note, the session was recorded and will be on MHPA's YouTube channel if you ever want to revisit it at a later time. With that, I want to thank Yvonne and Stephen for their time and their great presentation. Obviously, maternal and infant health is a big deal in the Medicaid space. We had an entire breakout session track dedicated to it at our annual conference in Indianapolis. So it's super excited to see a solution, and how it works, and then also the state of the current industry. So thank you for that very much. I would also like to thank everybody who attended the session today. We really appreciate you spending your afternoon with us and hope to see you on the next presentation. With that, I will go ahead and close the session. Have a great afternoon, everybody.
Thank you.